What happens when the profound wisdom of Chinese medicine is fragmented and only small pieces are used without their vital context? I'm your host, Lori Martin, and today on the Root and Branch Journal Club, we're diving into a thought-provoking article from the Journal of Chinese Medicine by Dr. Toby Daly entitled The Extractive Nature of Integrative Medicine. It uncovers a hidden dynamic in modern healthcare that most people completely overlook. Dr. Daly reveals that while the concept of blending different medical approaches sounds ideal, in practice, the dominant system often extracts pieces from ancient traditions, like Chinese medicine, without honoring their crucial context. We're going to dive into the examples to see the profound impact of severing these tools from their original holistic framework. Let's see why safeguarding the true essence of Chinese medicine is more vital now than ever, and what a more respectful, effective integration might actually look like. There's a story, likely apocryphal, but nevertheless incisive, about a 90-year-old Native American man who was asked what changes he had seen to his homeland since the European invaders had come. He answered that before the foreigners arrived, there were no taxes, no debts, no prisons. There were plenty of mushrooms, buffalo, berries, salmon, and clean water. Medicine men did not charge for their services. His people spent their days gathering, hunting, and fishing. Since the invaders came, all had reversed. He lamented that now everyone had to get jobs and could only hunt or fish on the weekends, if they were lucky. Integrative medicine is a very good idea in theory. It is hard to fault an approach to medical care that seeks to benefit patients by combining biomedical therapies such as medication and surgery with other therapies that have been shown through clinical trials to be safe and effective. In practice, however, the dominant paradigm of integrative medicine, which is invariably biomedicine, it extracts everything it deems valuable from other therapies without regard for its original context and subsumes it into its own paradigm. The process of trying to neatly fit the extracted therapy from its original ecosystem into the biomedical paradigm inevitably it degrades that therapy's benefits as well as increasing its risks. Huang is a good example. From the perspective of biomedicine, the focus is on its main active ingredient, ephedrine, and every other aspect of Huang is discarded. In the biomedical paradigm, ephedrine is simply known as a central nervous system stimulant. From that vantage point, there is no reason not to prescribe it to a healthy young athlete who needed a pick-me-up, even if they are training at 100 degrees Fahrenheit. From a Chinese medical perspective, Ma Huang is, as we know, never prescribed on its own. It's always embedded in a formula where the qualities of the other medicinals in the formula can enhance the beneficial qualities of Ma Huang and mitigate any unwanted side effects. According to the almost 2,000-year-old Shenlang Bansao Jing, Ma Huang is classified as a middle-class medicinal, and as such should not be taken long-term. Its nature is warm, and it's used to treat wind strike and cold damage. Its actions are to expel cold, effuse the exterior, and promote sweating. These qualities have been confirmed by 2 millennia of clinical use. As practitioners of Chinese medicine, we can definitely say that the warm, cold expelling and sweat promoting nature of a medicinal like Ma Huang is absolutely contraindicated for a young, fit athlete exercising and sweating in the heat of Florida summer. Unfortunately, Steve Beckler, a 23-year-old Major League Baseball pitcher for the Baltimore Orioles, consumed Ma Huang and, unaware of its Chinese medicine context, died after a training workout. The cause of death was determined to be heat stroke after his body temperature rose to 107 degrees Fahrenheit, 42 degrees Celsius. Another example of using an aspect of Chinese medicine divorced from its theoretical underpinnings is dry needling. The Huangdi Jingling Shu, Chapter 8, states, all norms of piercing require one to first of all consider the spirit as foundation. Practitioners of Chinese medicine who use the spirit of foundation are able to employ needles to address any disharmony that appears in the patient's body and mind. A dry needling technician, on the other hand, strip mines a tool from Chinese medical landscape, but not the context for using that tool. The technician employs a needle to activate a local twitch response to stimulate the sensory afferent A fibers to activate the enkephalnergic inhibitory dorsal horn interneurons to increase the levels of bradykinin substance P and the 37 amino acid neuropeptide calcitonin, gene-related peptide at sensitized motor end plates. This is world apart from considering the spirit as foundation for every needle inserted to a patient. Even the term dry needling is bizarre. As acupuncturist Benjamin Hawes noted, our needles have always been dry. I spoke with a biomedical doctor after he completed the weekend training in dry needling. He told me that since he used guide tubes to insert the needles, he could retain them for longer than 20 minutes, and I still have no idea what he meant by that. He was also surprised when he experienced syncope after his fellow trainees, also medical doctors, inserted more than 20 needles into his body to practice. Since he had no concept of Yang collapse and because there is no known mechanism between increasing bradykinin and syncope, he was at a loss for how this happened. Let us now turn our attention from these simple examples and examine the full application of integrative medicine as it is administered at a large medical practice near my office. Unsurprisingly, the director of the integrative practice is a biomedical doctor. The director decides which patients to get seen by which practitioner and for what condition. However, all patients are welcome to visit the vitamin B12 IV drip happy hour. The practitioners, medical doctors, naturopaths, chiropractors, massage therapists, and acupuncturists all have many letters after their name and vie to present to the director the latest research studies showing their modalities' effectiveness. Clinical trials of Chinese medical modalities are increasing, but they represent only a tiny fraction of the conditions successfully treated every day by Chinese medicine physicians. At this integrative center, the practitioners of Chinese medicine are restricted to only using acupuncture and only for conditions that have been proven effective in clinical trials. If the acupuncture intervention fails, the Chinese medicine as a whole is deemed not to work. This ignores all the other possible modalities that the clinician could have employed, such as moxibustion, herbal formulas, Tui Na, Qigong, nutrition, and lifestyle modifications. These modalities have millennia of successful outcomes, but they are disregarded by the director because they lack substantial and, in some cases, clinical trials. At the integrative center, if the acupuncture intervention does work, then Chinese medicine is diminished to being effective with just that modality and for just that condition. Only the narrow slice of Chinese medicine, cocooned into biomedical terms, is incorporated into the integrative model. When this model surveys the symbiotic old-growth ecosystem of Chinese medicine, all it can see is board feet of lumber waiting to be harvested. An alternative to this exploitive integrative model might be a three-tiered framework modeled after the middle and lower-class herb system of Shenang Beng Cao Jing. The upper-tier medicine would be focused on promoting longevity, and in our new model, this would consist of the patient adopting an appropriate regimen of diet and exercise. If any of the patient's symptoms are not relieved by this regimen, they would move on to the middle tier. The middle tier would include the full range of Chinese medicine modalities and other systems that fall into the integrative label, all operating within their paradigms. This middle tier, like the middle class of medicinals in the Shenang Bang Cao Jing, would be used to mitigate any already emerged illness and to prevent any new diseases from arising. Finally, the lower tier, which is according to the Shennan Beng Sao Jing reserved for the most toxic interventions. This tier should be avoided if possible, and if it is employed, only for very short periods of time. This tier would be accessed to treat fully manifested disease with surgery, medication, and other potentially harmful biomedical interventions. Like in the Shennan Beng Sao Jing model, the iatrogenic risks and toxicity increase as the patient descends the tiers of the model. This patient would not need to abandon any useful aspects of previous tiers as they descended the structure. For example, a patient would not need to stop exercising if they started getting acupuncture, or stop practicing Qigong if they were put on medication. This three-tiered model avoids the predatory nature of the integrative model. Each tier would operate independently and in its own natural lane without interference by foreign paradigms. Chinese medicine would operate unrestricted in the middle tier, and the practitioners in the lower tier would not have to import anything they did not understand, like ginseng, into their tier. Each clinician would work in full confidence from their own specific knowledge base rather than poaching techniques without context from other systems. Proponents of integrative medicine are completely uninterested in the Chinese medical paradigm. Integrative practitioners only want to extract anything they deem valuable from our paradigm and are unconcerned if they leave Chinese medicine as a discarded open pit mine. When assessing value, the integrative model treasures N of 150 randomized controlled trials conducted for 6 weeks at and disregards the N of hundreds of millions of non-randomized trials that were conducted over millennia in the clinic of Chinese medicine physicians. Some Chinese medicine practitioners, insecure in their own medicine and seeking validation, are eager to help integrative medicine with their gleaning. Unfortunately, these practitioners end up without deep roots in either paradigm and struggle to effectively practice. The sovereignty of Chinese medicine is under threat. Only practitioners of Chinese medicine with their intimate clinical knowledge of this medicine know its true significance. It is up to Chinese medical clinicians to protect and preserve this heritage. It is imperative that we pass this down as a complete medicine on its own terms into the next generation and not allow pieces of it to be fractured off into other paradigms. If we do not, then this generation, or perhaps the next, may be only able to practice Chinese medicine in its entirety on the weekend, if they are lucky.